Hi everyone, welcome to today's Family Talk. We'd like to welcome everybody today. Today I have Dr. Gentile, we have Carolyn and Wade Holt from Pike County, Ohio. And we're here today to talk about psychiatry, Ohio's Telepsychiatry project, and the benefits for folks that use it. This week is also Jobs in Demand Week for Ohio, and specialized psychiatry for folks with dual diagnoses of a developmental disability and a mental health condition is something that's really important for families and something that is not well utilized in rural areas because we just don't have the psychiatrists who are specialized in that area in those places across the state. So today we want to highlight that resource for folks and also talk a little bit about why that specialized psychiatry is so in demand across the state. So I'd like to start with Dr. Gentile. If you could explain maybe why this type of psychiatry is specialized and what the need for it is within the DD population.
Sure, I'd be happy to. We started a clinic back in the early 2000s, and patients were coming to us face-to-face. At the same time, we were traveling around the state of Ohio, and we provided educational presentations in various counties. And it was clear to us that there was a desperate need for psychiatry and for individuals who were specially trained in the mental health care field. But we had no way to reach those individuals. So fast forward to 2010, I had a prototype at one of my clinics where I offered patients, if you're willing to drive to us, then we could see you for psychiatry appointments, for counseling appointments, and then receive those services, but of course long distance. So as you can imagine, people were traveling an hour, 2 hours, 3 hours each way for a 30-minute or 45-minute appointment. When telepsychiatry came online in Ohio, I approached the director of both DODD and the director of Mental Health and Addiction Services, and I asked if we could have a prototype where we converted these face-to-face appointments with all of the travel and expenses to webcam appointments. It's software that's virtual in nature, it's HIPAA protected, and we had an exemption from the Centers of Medicare and Medicaid where individuals on the receiving end, such as the Holt family, could actually attend the appointment in a location of their choice. So they didn't have to go to a primary care office, a pediatrician's office. They could literally be in their own home, their own school, their day program, or a place of employment, and actually attend the appointment in a private office within that setting, and that's how it all got started.
Yeah. So, Mrs. Holt, if you could say maybe a little bit about what your experiences were before the telepsychiatry project, finding a psychiatrist in rural Ohio, what your experiences were.
There are no psychiatrists in rural Ohio, okay? That's the bottom line. I traveled from 90 until this came in to being, the telemed. I traveled round trip like 120 miles for an appointment. I have 3 sons. That was a lot of travel. But I did it because they had to have the service. You know, it is so much better to be able to keep them in their community and just, and I'm older now. So it's just better on all of us. It's great, actually, to have this program available to us. And I've got 4 or 5 people in my school that I've talked to, and they are now in the program. They wanted services, but they had no idea how to get them or where to get them.
So say a little bit more about maybe at the very beginning, what was it that kind of either forced you or that you wanted to seek out psychiatry services for your sons?
In 91, my middle son, we are Fragile X people, okay? And my middle son got an extremely good dose of the rage that can go along with Fragile X. And he managed to disassemble a school bus and hit the school bus driver. It was a bad situation, okay? We had just found out that we were Fragile X. And I called the geneticist at Ohio State and I said, you gotta find me a doctor because my middle son is a large man. He's 6'3" and weighs, what was it, I think it was like 368, 388, something like that. And, you know, he's very intimidating anyway. But I could see that being a problem in the future where, you know, the person that he hurt had been his bus driver for a long time. And the law was there because he had just turned 21. And she said no, she would not file charges on him because when Keith, as she put it, when Keith was like that, that wasn't Keith. You know, so I called them, they gave me 2 names. One of the names, and they recommended him highly, was Dr. Ralph Ankenman, who had his own setup in London, Ohio. And I called and everything fell into place with the good Lord's help, and we got him in there. And then as the other 2 developed problems, they started to see him.
So you were making the trip from Waverly to London for
Right.
those services.
Right.
Wade, Wade, do you remember those long drives?
Well, I ain't seen nothing.
I ain't saying nothing. You can talk, buddy.
I'll leave. I'm gonna, yeah, I'm gonna sit down.
That's fine. So, Dr. Gentile, what is the demand for this service? What are you seeing when you talk to folks across the state about the demand for psychiatry specialized in this area?
It's been really interesting since I have started seeing this patient population exclusively. First of all, over 90% of our patients come to us with aggression. That's the #1 presenting symptom. And really it's up to us to figure out, is there a untreated or undertreated medical condition? Is it a psychiatric condition? Sometimes we'll accurately diagnose psychiatric conditions, and then, or sometimes it's really just routing people to the right medical professional, some kind of interdisciplinary referral. So that's really what got me hooked. I thought it's so interesting to do that detective work, and sometimes it takes an hour, sometimes it takes weeks or months to come up with an accurate diagnosis and then create a treatment team around that individual. I also think the behavioral changes, that's what our job is. We have to determine the etiology of those. But we do know that the prevalence of mood disorders, anxiety disorders, and psychotic disorders are all higher prevalence in individuals with IDD. And so what we're seeing is people desperate for services. I've been seeing that since 2002, since I started this work. And it's pretty amazing to sit in a clinic in a small town in Ohio and then reach out to dozens of counties. So now we have, and it's a training program, so we have residents and child psychiatry fellows training with us. They should be exposed to this patient population during their training so that they have the confidence and the comfort level to integrate them into their practice after graduation. We have just under 1,400 patients now from 75 counties. So that's from 2012 through this most recent quarter. We're reaching out to a lot of rural areas, and just with the use of technology. And the webcam appointments actually, I really enjoy because you're seeing a side of an individual that you don't get to see in your own office. I see them in their school or in their home in a location that they've chosen, so they feel safe, and they're actually more revealing during these appointments.
Ms. Holt, you said in the 90s when you were first looking or trying to get recommendations for psychiatry services that there were 2 given to you. Mm-hmm. Have you seen or heard that number has increased during that time, or is there still a large shortage in that area?
There's still a shortage, especially in rural communities. You know, if you live in Columbus or you live in Cincinnati or Dayton, you know, one of the larger metropolitan areas, you may find someone without too much hassle. But if you're in a country, you know, setting, it's just not there. You know, and you see children being treated that, you know, I'm not a psychiatrist, but it's very plain, I've lived with it all my life, that they'll duly diagnosed, but you've got MDs dispensing antipsychotics and such to treat them, and they don't understand what's going on.
So you still see a need for it in your county and the families that you talk with?
Oh, yes, yes. And I'm always working on somebody to get them, you know, I'll get interested in their child and I'll think, you know, we need to be seen.
So Dr. Gentile, you said a little bit about the fellows and some of the training programs that you have going on. Can you say just a little bit more about that? Where are they targeted at? How can folks find more information or get involved with those type of training programs?
Sure. On our website, that's actually one of the things that medical students look for when we're recruiting for the next class. We have an adult psychiatry training program, which is a 4-year program, and we also have a child adolescent fellowship, that's an additional 2 years of training. We have the IDD clinic as one option, so it's something that the residents can choose for rotation purposes. And if they don't rotate through the clinic their 3rd year by choice, then I will typically talk to them as a group and say, you need to see patients with brain injuries or intellectual disability before you graduate. It's going to be necessary for you to have that exposure. And then I always tell them you should see technology, because technology is part of the future of psychiatry, and we are aligning ourselves with that future, and they shouldn't graduate without that experience.
So say a little bit about the technology component of it. We know that's an important piece and a vital piece to the Ohio Telepsychiatry project. How have you found the technology useful or easy to use? Or tell us your experience with it.
It's very useful in that I can tell people, you're going to make one trip to Dayton. And then from then on, you're free to come in here to my office, which, you know, they do. And I found as far as me, and I am kind of technologically challenged, but it's easy for me to get on there, you know, and set everything up. It's simple.
That's a great perspective from a parent. Well, what about your sons? How do they feel about interacting across the screen with somebody?
Oh, they do terrific.
Actually, in the office setting, I used to see the Holt men all together in one appointment, and as typical of Fragile X, there's sometimes an issue with eye contact, so they could wear sunglasses or a ball cap pulled down, and now I actually see them usually one-on-one, and then and there's I don't know, I mean they're so much more comfortable, they're more revealing. Right. They talk very freely on the webcam. Yeah. Better eye contact.
And they feel better with the one-on-one because they don't feel like they have to say something or not say something because their brother's there. You know.
Dr. Gentile, can you say a little bit about what technology is needed? Like what do folks need to have available to them, or where do they need to go to find the technology to be able to participate in this program?
That's a great question. Some of the families we work with don't have a computer at their home, and that's actually not a problem. Part of the grant structure that's supported by DODD and Ohio MHAS is that the county board has an obligation to link with the families, and so if the family doesn't have a computer, then the county board can either provide a private office in which to conduct the appointment that day, or they can put a computer in the car and drive to the family's home and set it up prior to the appointment and help them navigate that link. And really it's an email link. So on the receiving end, you need a computer with a webcam, and you need high-speed broadband internet, and then the rest is on our side. So we have virtual software, there's automatic updates, we pay for a specific number of licenses, and then we just make sure we have enough licenses for each appointment that's occurring at the same time. And with 1,400 patients, I think we have several dozen licenses. So we have all of that covered on our side.
That's great to know, especially in a rural area where broadband may not be readily available. Like you said, not everybody has computers in their homes. And so having that option to go to the county board or to a library or someplace where they can access that technology seems like a really great option.
We use both in our county. You know, now the county board, by and large, uses my office and me. Then we also have an ICFMR that some of the guys are seeing. And then we have a couple that are at home, and their nurse, through a company, takes a laptop in. And so, you know, it's like she says, you get to see them and where they're at and where they're comfortable.
Mm-hmm. I've done parking lot appointments. I've done appointments in cars. Patients have anxiety and can't, or maybe they are transported to the county board and then they don't want to get out of the vehicle. They can take the computer out into the car, and I'll talk to them where they are so that we can make the appointment happen.
Yeah, great. So we talked a lot about the project itself, the program itself. Dr. Gentile, maybe say a little bit about how folks can get started with it. What's the first steps folks need to take if they want to be involved in Ohio's telepsychiatry project?
Sure. Our point of contact is Ebony Mitchell. She is our intake coordinator, and she's at Access Ohio Dayton campus. We have her email address and her phone number. You can find that on our website, or I can give it to you now, whichever you prefer. Ebony's the first point of contact. We have a referral packet that we have designed, and it's really helpful for us. I know some people, when they're first getting started, they're a little overwhelmed with, there's a case manager appointment, there's a nursing appointment, a health assessment. Those are not our rules. Those are actually Centers for Medicare and Medicaid rules, or the rules per the private insurance company. So we have to follow all those policies and guidelines. But once you get started, and as Mrs. Holtz said, we do ask that people drive to Dayton, to our offices, so we can meet them in person for that first appointment. If it's not possible and we agree on both ends, we can actually do the intake by webcam, if that's safer for the patient or if it's preferred by the family. But if possible, and if it's safe, we do like to have people in the office the first time. Everything else is conducted via webcam wherever the patient is.
Awesome. Mrs. Holt, talk a little bit about the outcomes that you've seen for your sons through this project. From the beginning, as you mentioned, when you started with this project to now, what are the differences that you've seen, any positive outcomes?
Nothing but positive outcomes. You know, I mean, we've had our ups and downs, you know, but you're going to have that. And, you know, medications, I know, you know, as I would say, I'm preaching to the choir, but medications, you'll get them right, and you'll think, this is so great. And then 6 months later, you're back at it again. So that's one of the great things about being able to have a doctor and a psychiatrist that you can get a hold of and say, look, you know, we just went off the charts, what are we doing? And it's always been there for me and my son since we started it. And we've used it 2 or 3 times. You know, so it's a very, I can't say enough about how great I think the program is.
Good. So as we wrap things up here, any closing thoughts or anything you would like to highlight about the program for folks?
Sure. We're not trying to take over mental health treatment for everyone in every county. Of course, there are so many families and individuals still in need out there. Our goal at the start was that we would go to a county, we would identify a team lead, a county team that's local, and that can route people, be a referral source to route people to local clinicians. Our idea with this project was to provide psychiatric and counseling care to the most complex needs individuals in each county. So we would like people at the local level to do that triage process where you determine who can we take care of through pediatricians, internal medicine, and family practice offices, and local psychiatrists, and then who are those that are just using an inordinate amount of resources, and maybe we need some outside help from a statewide grant-funded project.
Great. Any final thoughts from you, Mrs. Holt?
I'm just thankful for the program.
Well, I'm thankful that both of you spent your time here today with me and sharing this information with our audience today. Again, a reminder, this is Ohio's In-Demand Jobs Week, so check out that information. You'll see information there about psychiatry and the need for specialized psychiatry and dual diagnoses. Also like for you to check out the website, www.miidccoeohio.org. And the Ohio Telepsychiatry Project is featured on that website. You can find more information there, including the intake process that Dr. Gentile was referring to earlier as well. So again, thank you to everybody here with me today.
Thank you.
Thanks for everybody for watching. We'll see you next time on Family Talk.